everyone. Welcome back to the Dish on Aging Tip of the Day. Today is Monday, September 20th, 2021. Today I'm going to be talking about two things. First, I'm going to provide a follow-up to my presentation Tip of the Day from September 23rd, 2021. Then I'm going to talk about things to be aware of during Medicare open enrollment. Before I get to that, let me remember to introduce myself. For some of you, you may be new to this website. My name is Dr. Maureen Sweeney. I am a clinical psychologist with a specialty in geriatric psychology, and I practice here in Bensalem, Pennsylvania. Okay. So on last Thursday, I talked about a news article that where the insurance company Aetna is being sued. It was a whistleblower lawsuit, being accused of creating and then lying about creating a phantom panel and then lying about that, saying they had enough providers. Let me back up here. Phantom panel means that an insurance company, usually an HMO, as part of their marketing, they say, we have this thousands numbers of providers. You come on, you be a customer of our insurance company, and we can guarantee you we will be able to give you access to any provider specialist you might need because we have this many thousands of providers. A phantom panel is when there are names of doctors that the insurance company says are on their provider list, and in reality, those doctors are not on their list, and those doctors will not schedule an appointment with you. And in fact, part of the lawsuit that Aetna was sued last week, some of the providers, what makes a phantom panel is some of the providers were in fact deceased. So there are several states that are suing Aetna. It goes back to 2004, so they're going back in time quite a bit. And the lawsuit is based on specifically Medicaid and pediatricians. I want to again give an overview. CMS, Center for Medicare and Medicaid Services, these are federal insurance programs that are either run or monitored by the federal government down in DC. Medicaid is, think aid, that's for low income. Medicare, every American, once you turn age 65, you're eligible for Medicare. Medicaid is for low income, so there are going to be a large number of children in Pennsylvania who qualify for the Pennsylvania Medicaid program. So the lawsuit against Aetna has to do with their Medicaid pediatrics program, so it doesn't have to do with geriatrics. On Thursday, I explained that lawsuit because it might be that, in fact, I do think that there are some phantom panel problems happening here in Pennsylvania, and I think it contributes to the reason why people here will have trouble finding a psychologist or a mental health provider when they need one. So if you want to get more information about that, go to my September 23rd tip of the day so that you can know what that's about and what you can do to protect yourself. So some feedback I received since Thursday, somebody said, oh my goodness, I have Aetna Medigap. Do I need to switch insurance companies? And the answer is no. Here is something else that adds to the complication that most people don't even realize. All of the major insurance companies, so whether it is United Healthcare, Aetna, Humana, any other insurance company, Independent Blue Cross, they're one company and they have separate divisions. So Aetna will have, and they're not the same plans. It's like a different company. It's just like Ford Motor Company is a big car manufacturing company. They have their Ford trucks, they have their Ford Escorts, they have their Ford Mustangs, and these are going to be three very different cars or vehicles with the trucks. If there's a recall on one of the trucks, it has nothing to do with, or usually would have nothing to do with any of the other models. Also, the cars are going to, and the trucks that Ford Motor Company offers, they're going to offer completely different features, and because of that, they're going to be completely different plans. So, when you're dealing with Aetna, and this adds to the confusion, Aetna is going to have a Aetna Medicare plan, their HMO plan. Aetna is going to have Aetna PPO plan, and Aetna is going to have a supplement, a Medigap for original Medicare. So somebody may call me up for an appointment and I'll say, "What's your insurance?" And they say to me, "I have Aetna." And I said, "Okay, which plan?" And they'll say, "I have Medicare Aetna." I say, "Okay, Aetna has 3 plans." Most people have no reason to know that. It's important for me because I accept the Aetna Medigap. I don't accept the other insurance plans. So that's how I need to know. Also, one of the factors that contributes to phantom panels is exactly what I just explained to you. Aetna and the other insurance companies as well, if you're an in-network provider, they don't always do a good job when they have these big booklets and you can go online to find out who's an in-network provider. They don't do a good job saying, okay, that's a provider for the Aetna Medigap, and this is a provider for the Aetna HMO. So it looks like they have a big provider panel when in fact they don't. So I wanted to give that follow-up to last week's presentation about how Aetna is being sued, just so that my tip of the week last Thursday was try to follow this lawsuit to educate yourself. Tip is to educate yourself about the concept of phantom panels. It's a crime for an insurance company to put together a phantom panel, and also to recognize when you're being victimized as a Medicare recipient by a phantom panel so you can know how to respond. And one of the easiest ways to respond is to either contact your local area on aging to see if they can advocate, or to contact your local elected official who has an office down in DC, so one of the 2 senators or one of the state representatives, to see if they can look into your concern. I always tell, and then it'll be a complaint to the insurance company, and that is all free for you. It's never the best idea just to jump to paying money for an attorney, because the system is set up for you to go. You don't necessarily want to complain to the insurance company, although you want to start there and tell them, "I can't find a provider. Can you help me with this? Can you produce a provider for me?" You want to start there, but you don't want to necessarily follow up with the complaint. It's like going to the fox who's guarding the hen house. A lot of people don't realize that the area on aging and local elected officials also can be there to help you guide your way through to the insurance commission is also an advocacy organization that is designed to protect the residents from insurance companies who may not be following insurance company regulations. But like I was saying on Thursday, you basically either have to know the ins and outs of insurance rules and or be an attorney to understand, a health insurance attorney, to understand if you actually have a complaint for the insurance commission. So it's really complex. And I know what you're all thinking, I'm paying my premiums, I'm doing my part, and I just need a provider. I don't want to fight City Hall. And I know that's part of the problem, is that that's how we all are thinking. But the reality is is that for some individuals, they're still having problems finding providers. So the point of my tip of the day is to educate yourself by following this Aetna lawsuit. Aetna's being sued in different states. Pennsylvania is one of them. Just follow those newspaper and news reports so that you can learn about what is a phantom panel and why is a phantom panel is not good for the public. It's not good for Medicare beneficiaries, and it does come into play. So that's a summary of last week, and what I want to talk about today, tip of the week, as we're getting into Medicare open enrollment. Medicare Advantage plans are the private insurance companies. Medicare, original Medicare is the traditional Medicare. Usually with the original Medicare, you then will purchase a supplemental plan. Those plans generally, aside from the beginning of the year, $200 deductible, you basically have no out-of-pocket expenses. The problem with the Medicare Advantage plans is lower insurance premiums. Sometimes they'll advertise no insurance premium, but then you'll pay through the nose for every time you go to the doctor or if you have to be hospitalized. Then the Part D as in Donna, the Part D plans are the medication plans. Because we're in open enrollment, if you're thinking about changing your plan, here's from an original Medicare to a Medicare Advantage. My advice is just don't do it, but look into it. The reason why I say don't do it is because many times seniors are misinformed or don't understand how much they could end up having to pay more for their health care every month, even though they have a lower premium. They end up having to pay more because of copays. Nobody's foolish. The only reason why they transition from an original Medicare to a Medicare Advantage is to save money. So what seniors will start to do is they'll start to ration their own health care. Meaning if their endocrinologist says, I'm not sure of your diabetic medication dose, come back next month, and they have to pay $40 every time they go, they'll go back in 3 months. If their pain management doctor says, I really want to send you to physical therapy, that is going to help reduce your back pain dramatically, and then they find out they have to pay $40 copay 3 times a week, they don't go. Or they'll go to physical therapy and say, I can only go once a week, I can't afford it. So all those kinds of problems I have observed coming up with the Medicare Advantage plans. So I advise people just generally to stay away from those plans. With that being said, there are 2 ways that you can get education and objective information. Everybody is individual in terms of what their healthcare needs are. So even though you might have your neighbor next door, your friend across the street, and your sister on the other side of the country who have a particular Medicare Advantage plan, let's say through Humana, it doesn't mean it's going to work for you. Our local county area on aging, for free, emphasis for free, it will cost you no money, they will help you schedule with a trained volunteer who will sit down with you and hopefully a family member with you, and they will go over which Medicare plan will be best for you. That's called the Appraise program. So consider that. The other is Ben Salem. In the first week in November, I received an email about this last week, I think early this week. Free information. Ben Salem Township is offering an evening 2-hour class on how to understand Medicare Part A, Medicare Part B, and Medicare Part D as in Donna. So if you live in Ben Salem, call the township to find out more about that. What I advise people to stay away from is there are insurance agents who will say, call me, I'll help you decide. I find that the insurance agents, by and large, are really good intentioned people who just have no idea what they're doing. And I can't tell you, every single year, a family will go to that agent, and that agent will absolutely guarantee you're going to save money, you're going to find all kinds of providers. And then whammo, it's the first week in July, and your oncologist or the doctor who's giving you that infusion for whatever your osteoporosis says, why did you do that? This medication is now going to cost you $6,000 a month. You must get it, otherwise you're going to be in a nursing home because of your injury. And what did you save switching to the HMO? And they'll tell you, oh, I saved $35 a month. Well, now you just lost all that savings because now you have to pay however many thousands of that medication that insurance agent had no idea about. Or so they didn't give you the correct advice because they didn't have the correct information. This happens. It doesn't happen to everyone, but I know somebody every year that this happens. Rest insured, another part of this tip of things to be on the lookout for during open enrollment. Even though there's open enrollment, I don't even know the months, October, November for Medicare. Then the new Medicare goes into effect January 1st. I can tell you the first 2 weeks of January, there are a lot of people that switched over to Medicare Advantage and they realized it was all wrong for them. You can call Medicare and they will switch you back, even though you're not in the open enrollment anymore. The reason why Medicare does this, has this as an option, is because they recognize that this is so confusing, and also Medicare beneficiaries do get misinformed. And Medicare doesn't make a judgment on whether or not somebody did that purposely or not, because reality is Medicare got fed up with identifying insurance agents that were purposely misinforming Medicare beneficiary. So Medicare doesn't even care if the agent is deliberately misinforming you or if it was accidental. My observation is 99 times out of 100, it's not deliberate. The agent just doesn't know enough to guide you towards what Medicare plan is best for you. So you say, what do I do? Well, here's what you do. You get as much information as you can. You go to your local county appraise agent. You go to the local Bensalem Township information session about the different plans. And again, understand the concepts between original Medicare and Medicare Advantage. The idea of Medicare Advantage is they say they'll bring their premiums down and then you just pay higher copays. That's why you got to sit down with a calculator. How many doctors do you go to every month, every year? How many medical problems do you have? Also, your Medicare Diaz and Donna, that you don't have to be connected. Sometimes you'll get somebody's getting a commission from Humana, for example, and they'll say, if you go with Humana A and B, you have to go with Humana Diaz and Dog. That's actually not true. Also, you'll hear Joe Namath getting up on television talking about all these additional benefits Medicare offers. What Joe Namath does not say is he's talking about the Medicaid. Remember, I was talking about pediatrics, Medicaid low income. If you do qualify for SNAP benefits, that means food stamps. If your income and your assets are so low that you qualify for SNAP, most people don't, but many people do. If you qualify for food stamps, then listen to what Joe Namath has to say, because he's talking about programs you qualify for. But if you don't qualify for food stamps, then you want to stay away from these Medicare Advantage plans. That's my biased recommendation. The reason why I say that is because I counsel people when they're emotionally distraught, and people get emotionally distraught when they have to start rationing. What doctor are they going to go to because they cannot afford the copay? I know what you're thinking. You've heard about a program that will help seniors with their copays. Well, you have to qualify financially. So if you qualify for food stamps, you actually probably qualify for the state to pay for your copays. And that's why you should go to an HMO if you qualify for food stamps, now called SNAP, because then you can get all these benefits that Joe Namath is talking about. If you don't qualify, and it's paid for, it's free for you. If you don't qualify for food stamps, then you have to pay your own copays, and you don't have enough. There's a country music song, you don't have enough month at the end of the money. So in actuality, you think you saved money, switching over to a Medicare Advantage plan when really you don't. You end up spending more money because you have a lot of different medical problems, and then you don't have the money. And so then you have to make a decision on what you're going to do. By the way, that was the whole point of Medicare Advantage plans when they were first developed, however many decades ago. They said the concept was we want to do cost sharing. If the patient has to pay $40 every time they go to physical therapy or every time they go to a dermatologist, are they going to go as frequently? And I mean, I've had to have melanoma cancer removed from my own body, and I'm sure some of you have as well. It's 1 in 5 of us that is going to have a type of skin cancer removed from our bodies, and hopefully it's caught early so it's a non-issue. So are we going to have to, start wondering, okay, I can't go to the dermatologist this month. I won't have the $40 for that until February of next year. I mean, that's just not a good way to be doing healthcare. Also, our health insurance plans are, and so that's the reason why I say stay away from the darn HMOs. If you have original Medicare with a Medigap, you got something on your skin that doesn't look right, you just schedule and go. You have no worries because you have no copay. So also insurance plans are for the next 12 months. You sign up in the open enrollment. It starts January. It only goes for the next year, which is 2022. So if you don't like the plan you selected, you can always change back 2023. Be careful if some of you have